Welcome to This Week in South Carolina. I'm Gavin Jackson. This week, South Carolina continued to gradually reopen as the governor lifted his work or home order and restaurants allowed outside dining for patrons. Though public health officials still stress that people need to maintain social distancing guidelines and hand washing protocols. This in light of a new and ambitious plan to test 2% of the state's population over the next 2 months. Here's the latest from this week. On Tuesday morning, hundreds of cars idled along the shoulder of a two-lane road in Society Hill, a Darlington County hamlet, as drivers and passengers waited to go through intake areas and then be tested for COVID-19, whether they were symptomatic or not. The Department of Health and Environmental Control partnered with CARE South Carolina on its first free mobile testing site in the rural PD region as the agency ramps up testing of people in medically underserved and minority communities which have been disproportionately affected by the virus. Inside the third tent, the hot zone, workers were in gowns, masks, shields, and gloves as they peered through cars and truck windows to swab the back of patients' throats, nearly 500 that day. Darlington Democratic Senator Gerald Malloy was on site and got tested himself since everyone was eligible at the mass testing event. He said working with the governor's office made the free testing site a reality within a matter of days.
And so we have generations of poverty that led to obesity, hypertension, and other issues. And so the real issue behind all of this is testing. And if we're going to end up moving South Carolina forward, getting South Carolina back to work, there's a lot of folks that need the testing. So we got to be able to have the knowledge of who has the virus, who has not. And you see the reports that come out now, there are many reports that are saying that people are walking around with the virus and may not even know it. And so we have a general issue with access here in the rural areas. And this is an opportunity to start having the access. So this is the first time in this region that is being done. So if there's such a hunger to end up getting the test done now, particularly with a free test, I think that this is just a start.
African Americans comprise 46% of the state's first 296 COVID-19 deaths, but as a population only represent 27% of the state. As the disproportionate trends emerged, DHEC ramped up its messaging efforts to communities of color, dispatched rapid response testing machines to rural and underserved areas, and will now roll out more sites like this one in the coming weeks as part of its new testing plan.
Our rural counties account for 9 out of the 10 top counties for infection rates per capita. DHEC and the CDC conducted a gap analysis to identify county-level gaps in COVID-19 testing in the non-institutionalized population across our state. We will use mobile testing sites, community paramedicine, and community healthcare and retail partners to increase testing capacity in these communities.
Hospitals, federally qualified health centers, and other providers have partnered with organizations in other parts of the state to test people with or without symptoms or a doctor's referral for free. But the African American community is not the only minority group that has been historically medically disenfranchised and at risk.
Yeah, well, our health issues for the tribe, it's just not only the tribe, but the communities. But I myself, I have CPOD, enlarged heart, black lung, high blood pressure. But you know, I'm blessed because I still can walk and still talk. But you know, these issues that I have, a lot of our members also have. And not being able to get to the doctors like they used to is hurting a lot of people.
DHEC will work with other partners in the coming months to host pop-up testing sites as it looks to test 2% of the state's population, a move that Governor Henry McMaster celebrated this week.
As you know, when this virus hit, the virus was chasing us, but now we are turning the tables and we are chasing the virus.
In order to begin the safe transition back to our day-to-day quality of life and vibrant economy, South Carolina will need to increase per capita testing to allow for more precise public health interventions that will help reactivate our economy. To assist in this effort, the federal government has committed to provide DHEC with enough swabs and testing supplies to test 2% of South Carolina's population during the months of May and June. Through our testing plan, our goal is to test 2% of the population, or 110,000 South Carolinians per month. Specifically, our plan focuses on 4 key testing areas: universal testing of nursing home residents and staff, expanding testing in under-resourced minority and rural communities, conducting mass testing in urban areas, and finding additional testing sites.
And joining us now to talk about businesses reopening in South Carolina is Ted Pitts. He's the president and CEO of the South Carolina Chamber of Commerce. Ted, thanks for joining us.
Thank you. Thanks for having me.
So Ted, you all released a survey this week from several thousand businesses. Give us a little idea about what businesses are saying in that survey and how businesses that you've been talking to are faring.
Yeah, so the survey we did in partnership with the Governor's Office and Accelerate SC, as well as the Department of Commerce. And it was really to try to get an idea of what businesses are feeling and doing in this current and uncertain time. You know, about 5,000 businesses participated across the state. You know, the governor was really interested in hearing from small business, so we partnered with our local chamber partners around the state to have their members also participate. So about 5,000 businesses responded. You know, I don't think there were a lot of surprises in there. I mean, business right now is ready for things to get back to some sense of normalcy. You know, they identify as paying bills and, you know, workforce as the top issues, you know, dealing with having to furlough folks. You know, one thing that was in the survey, that about 40% of the businesses that responded said they had already laid off or furloughed employees. And about 43% of those 40% that have already furloughed or laid off employees said, I don't think I'm going to be able to bring everybody back in the next 3 months. So, you know, as we look at trying to get out of this, demand we need for customer demand of services and products and manufacturers for their goods. So, I mean, ultimately, I think, you know, businesses are ready to get back to the new normal, whatever that's going to be.
Mm-hmm. Yeah, and you're talking about workforce, and you're talking about a lot of different issues. There's so many factors at play here. One of them that was brought up from the committee, the subcommittee, talking about this was childcare and the need for, you know, if parents are getting back to work, who's going to watch the kids? And there's already plenty of working parents out there who are juggling that right now. These parents who are deemed essential have had to juggle that already. What's that like, and how do you address this when there's so many different issues at play right now?
Yeah, so in the survey, we had a question that actually addressed that issue, and there is a lot of concern from employers that their employees, you know, have children, school-age children in some cases, that would typically be in school and then an after-school program, and they're not right now. So I think the governor and Molly Spearman did the right thing by closing schools for the rest of the year, but it has shifted a burden onto the business community, and how do they care for their employees who have to care for their children? So, you know, 52% of child care centers in this state are closed right now, are not open. So in addition to schools, child care facilities aren't open. So we've got to find a way to safely get child care centers back online and open so people can return to work. And I think one thing that we would say is government masters probably going about this in the best way you can go about it from a business perspective when you look at what stay-at-home orders look like in other states. So the business community is really lucky on that front, but now as we open things back up, we've got to do that safely, and businesses want guidelines, and they want their, you know, the child care centers to have, you know, safety measures in place so that the children and workers are safe.
Mm-hmm. You talk about safety, and one of the big issues in your survey was about 40% of these businesses said that there's concern about not having enough personal protective equipment for their employees. So should we be opening up if that's the case, or, you know, moving forward at this pace if there's not enough equipment to keep people safe, or how do you mitigate that and also juggle reopening?
Yeah, so first I would say every business owner has to make the decision as to whether they can open or not. So if they don't have PPE, they probably should get PPE for their employees before they open. You know, the first thing I think we need some basic guidelines that businesses can look to, depending on what industry sector you are, that lets you know what safety looks like. And, you know, nobody cares more about the health and welfare of their employees and their customers than the business owner, the business leaders. So we've got to remove, you know, some of the restrictions. There aren't a lot still left in place, but some of the restrictions that allow people to make decisions on their own. So I think we're hopeful that that's happening, and that business owners will use common sense, customers and employees will use common sense and follow CDC and DHEC guidelines.
And Ted, when we looked at the governor lifting the stay, worker home order this week on Monday, what's the significance of that? I mean, maybe mentally, or when we look at moving the economy forward, how's that played out? And do you think that's, making a difference in what you've been seeing this past week and how things are moving?
Yeah, so I think, if you look at survey respondents, about 50% of the respondents said they want orders lifted, all orders lifted. And I think a lot of that's more psychological than anything. Folks have been able to be at home or be at work. That's basically what it allowed you to do. So, there weren't a lot of industries across the state that were actually shut down. But I think it's a psychological thing, but I think we've got to keep harping on that. We've got to, the most vulnerable populations need to stay at home, right? If you're elderly, if you have a compromised immune system, you need to stay at home. And then everybody else needs to use common sense. You need to social distance. You need to follow those guidelines. You need to wash your hands. In some cases, you need to wear a mask if you're going to come in contact with folks. So, we need to follow those guidelines. But, business is going to look after its employees and customers. One of the things we hear about is businesses concerned about the liability. So, if as we open up businesses, they want to know that if I follow the safety measures, that somebody's not going to sue me or claim that somehow I put them at risk. Because in some cases somebody comes down with the coronavirus, they could claim they got it anywhere. You don't know exactly where you got it from. And I think businesses want guidelines to follow, and they want some protection that allows them to safely reopen and not be concerned about frivolous lawsuits, people claiming that somehow they didn't do something that they should have done. Not trying to protect bad actors. If somebody's not following the safety guidelines, that's a problem. But if businesses are doing everything in their power to make sure they're following guidelines and keeping employees and customers safe, it's time to let them start making those decisions.
So you're talking about that safe harbor legislation that you want to see lawmakers maybe pass next week when they come back. It sounds like it's going to be a heavy lift just because we're talking tort reform, and that's hasn't really been accomplished much headway on that in the past couple of years here in South Carolina. So do you think that's a possibility? I mean, how do you weigh that, especially too when you see these OSHA complaints from workers? You saw that walkout at that chicken plant in West Columbia the other day from some workers who say not enough PPE, but then the company came back and said that they have had some, and then you have workers saying that they're not getting paid enough to be deemed essential. I'm just wondering how you juggle all that and then also try and give protection at the same time for employers.
Yeah, so it's a top issue. It's something the General Assembly needs to address. It's in the healthcare space. It's obviously across all business sectors. We're hopeful the General Assembly will see it as the priority that it is. Alabama is working on it. North Carolina, I think, passed something this past weekend, working over the weekend. So, our policymakers, we have a track record for being a business-friendly state, and this is something we need to do to maintain our standing as a business-friendly state. Because if you want business and the economy to reopen, then employers have to feel like there is some protection, some safe harbor if they follow the best guidance out there, that they're protected from folks that claim they put them at risk. So. Again, bad actors need to, beware. We wouldn't want any legislation that would just, kind of blanket protect everybody. You have to follow safety guidelines, and if you do those, then there should be some protection. And we're hopeful it may not happen next week, but we're hopeful that it's something that they will address, and we're going to ask them to address it.
Very quick, Ted, we have about 2 minutes, and I want to talk about unemployment numbers that just came out, but stick with the legislature for a second. Do you foresee any legislation that will be coming out that we've seen come from Accelerate SC, maybe moving forward next week? Obviously, there's talk that the continuing resolution to keep the state funded will go through one way or another, but anything else that you are hearing that might happen next week at the State House?
I don't know what else will happen specifically next week at the State House. I do know that the signing die resolution will hopefully allow for the General Assembly to come back at any time to take up and address COVID-related legislation. So I do think there's an interest. Obviously, the Chamber and other business industry sector associations are working on different proposals that we think will help put business back on its feet. Business has been pushed into, and the economy's been pushed into a recession, and government needs to do some things to help get out. And that's not necessarily just hand out money. There are some things that can be done, like moving for tax filing and other things back that would just be something that would help businesses in general.
And Ted, just really quick, 453,636 South Carolinians have now, filed for unemployment insurance claims. There's talk about concerns about them coming back to work, especially when you factor in unemployment insurance payments from the state and the federal government totaling upwards of $900. What's the concern there for employers trying to get these employees back, and how, what protections are available in order to make sure that they come back, or that they're not just taking, unemployment, just even though there are jobs?
Yes, so obviously a lot of people have been separated from their jobs. Some are still attached, which means the employer plans to bring them back. Some are not. It's a problem that the federal legislation, pays people in some cases more to sit at home than to come to work. But DO has a website with a form on it that businesses can go to. If you have recalled a worker back to work and they have denied or told you they wouldn't come back, and you can fill out that paperwork and their benefits will be discontinued. The extra $600 a week, that benefit ends at the end of July. Senator Graham and Senator Scott, who spoke to Accelerate SC, the subcommittee I'm on, said, they're not going to extend something that pays more people to stay at home than to be at work. So it is an issue, but, these are unusual times, and we'll work through it. And hopefully, as we get into the summer, the economy will pick back up, and many of these folks can be brought back on. I do think, we're not going to have a V-shaped recovery. Obviously, I think everybody agrees that it's going to take a while to get out of this, but ultimately, I think South Carolina's positioned with opportunities to come out of it better than we were before. I don't know if that's on the unemployment front initially, but there's some opportunities that we can take, and South Carolina's positioned to be a leader. Reshoring manufacturing jobs, for example, we shouldn't depend on China for all the PPE that we need in a time like this. We ought to source it, and there's companies around the state that are doing that a lot, and have stepped up and have started doing that because of the need. So we need to figure out how to do things like that, use this crisis as an opportunity for the state.
A lot to look forward to going forward. So Ted Pitts, President and CEO of the South Carolina Chamber of Commerce, thanks for joining us. And joining us now to discuss the upcoming primaries is League of Women Voters Vice President of Action and Issues, Lynn Teague. Lynn, great to see you. Hope you're doing well.
I am, and good to see you. Thank you for having me.
So Lynn, we were just talking before we got on here. The South Carolina primaries are a month away. State Election Commission has said that several poll managers will not be working due to concerns. Some precincts will be consolidated because poll location owners really don't seem to want to have some people coming to their locations. What do you make of this very fluid situation? Again, now that we're about a month away from these primaries in June.
Well, I think we have an issue for the primaries, and I think we can understand that we also have an issue for the November general elections, because no one is optimistic enough to think that there's going to be wide distribution of an effective and safe vaccine for COVID-19 before then. So it does not make sense for the government to require people to gather together in close quarters to vote. We have already in place a system of excused absentee voting for some people that could be expanded, and if expanded would take a lot of pressure off. Yes, we know that many poll workers don't want to work. That's a reasonable decision on their part. The average poll worker is probably around 70 years old, from what I'm told, and that is well within the danger range for COVID-19 being a truly disastrous disease. Why would people expose themselves to that? That asks for an awful lot of civic commitment. Locations that allow polling, normally you can understand that they might not want the entire neighborhood coming through in a pandemic. It opens them up to liability. There are all sorts of issues, but we do have safe, secure alternatives. And so certainly the first preference would be for the legislature to simply expand absentee voting to everyone. Give everyone the choice of mail-in voting, which we already have for some people, or in-person early voting, all things that would take the pressure off and would minimize the crowds on election day.
And Lynn, we're talking about, for certain people to vote absentee. There's I think 18 reasons why you can vote absentee in the state. It's kind of our early voting, and like you said, it's already ongoing right now in person, and you can also do it by mail at this point. But that would require some people to lie, essentially, because a pandemic is not a reason to early vote absentee in the state. We've seen several lawsuits already filed. I know the League of Women Voters has supported these lawsuits, and we're even seeing some response from Republican Attorney General Alan Wilson saying that he wants to see the Supreme Court, move quickly on these decisions. What's your take on this, and how do we remedy this situation? Is it too late to remedy this situation?
It isn't. It is not too late. Opening up the absentee voting can still happen for the primary, certainly can happen for the general election. Our existing vote by mail is certainly, from a public health point of view, the safest thing we can do. Now, we know that some people want to vote in person. Some people with disabilities prefer to use the machines. So we're not asking that everybody be required to vote by mail. But our system is more secure than some in that you have to request a ballot. The ballot is sent to the address of the registered voter on application. And then the voter must finish the ballot out and sign it and either return it by mail or in person to an office. They must, however, select one of those 18 reasons that you can vote absentee. Anyone over 65 can. But it isn't just people over 65 who are at risk, and it isn't just people over 65 who can transmit the virus to others in their household, in their neighborhood, in their community. Having everyone required to vote in person endangers everyone. One thing we're especially concerned about is the extent to which this has been made a partisan issue by some people. We do not believe it's a partisan issue. We know that there are people in both parties in South Carolina who understand the importance of doing this.
And Lynn, I actually recently spoke with the governor about this after a recent Accelerate SC meeting, asking about making sure he'll ensure that there's enough money to, make them safe, because again, we have to have these polling locations. Yes, people will say, oh, just vote by mail. Well, you still have to have polling locations opened, as many as we can. He said that there will be money there to support these people. We heard from the Election Commission saying that there's training in place. They're going to have PPE in place. There's going to be shields and disinfectant. Is that going to be enough? I mean, I know it's a primary, so we don't see the general election type turnout that we normally see, but it's still, you're still interacting there at that level.
Yes, it's an unnecessary risk. And those are a lot of protections that certainly should give poll workers a little more sense of security. But when you have a lot of people going through an enclosed space in a relatively short period of time, I don't think there's any way you can say that the risk is entirely mitigated, especially since the scientists now say they believe that it can be, the virus can exist in the air for a while, especially in an enclosed space.
Yeah, we'll say that the Election Commission did recommend people, if they have a mask, to wear it, but again, not required to wear it. So, but moving on from that, talking about the absentee ballots, is there a worry that there will be a crush of ballots? I mean, those kind of don't get counted until the very end there at the election offices in the counties. Is that a worry? Do we know if there's an uptick? I haven't checked the recent numbers because we just really started with this at this point, but I'm wondering if there's going to be an influx of that. And then also, legislature's back next week, they can change these rules for people to vote. Do you expect that to happen?
Well, certainly there is a bill, S-867, that has already gotten through the Senate that would double the amount of time for counting absentee ballots. We do already know that there's a substantial uptick in the number of people asking for absentee ballots over what we would normally see. Even without that, we needed more time. The current system will require that people feed these absentee ballots through the scanners, one by one. And so the bill originated by Senator Campson in the Senate predated any knowledge of the pandemic. It was simply knowing that there was too much pressure on poll workers to actually be able to accomplish that in a day. So it was going to double that time. Well, we need more time than that. 867 has gone through the Senate. It's stalled in House subcommittee, but it could be recalled from committee. It could move forward. When the General Assembly wants to do something in a hurry, it can do something in a hurry.
And if not this week, obviously if they get that sine die resolution, they can come back later. And they are talking about coming back later in September to finalize a budget because they are all going to be operating continue resolution. With about 30 seconds left, do you see any movement? Have you heard any movement? I know it takes a long time to get a bill passed, let alone one during a crisis. So any thoughts on that?
All I can say is that I've heard encouraging noises from both legislators and senior staff at the General Assembly that there will be attempts to do something to make these elections safer and healthier for the general public.
Gotcha. Thank you, Lynn Teague, with the League of Women Voters in South Carolina. We appreciate it.
Thank you.
To stay regularly updated throughout the week, check out the South Carolina Lead. It's a podcast that we've been dropping multiple times a week on South Carolina Public Radio and wherever you find podcasts. It's a great way to stay updated on COVID-19 news in South Carolina. From South Carolina ETV studios in Columbia, I'm Gavin Jackson. Be well, South Carolina.